Thank you guys for being here this evening. My name is Levy King and I serve as the board chair. And on behalf of the entire board of directors and the Mobile Area Black Chamber of Commerce's members, we welcome you here to this event tonight. We thank all of our wonderful panelists that have carved out their time. We thank all of our board members for carving out their time as well, leading this event and just setting us up to be educated tonight and to be able to educate not only our members, ourselves, but also the community. So thank all of our guests for being here tonight as well. Thank you guys for being here. We look forward to a wonderful event. I'll turn it back over to the facilitators at this time. Thank you all.
Thank you, Levy, for those greetings on behalf of the Mobile Area Black Chamber of Commerce. It is very exciting to have so many of you with us tonight. Dr. Nina Ford Johnson is going to introduce our panelists at this time and give us an overview of how the evening will flow. Dr. Johnson, thank you so much for pulling the panelists together. We're excited to learn even yet more about this pandemic that we have been facing. Every day there's something new that we can learn. So we have our good listening ears ready, and I will turn it over to you, Dr.
Hey, y'all,
Ford.
it's Scott Chambers from Mobile County Health Department. I'm not hearing any audio. Are you?
Okay, let's see what's going on.
Okay, it's on my end. All right, it's on my end. I'm working.
Hey, good evening. Thank you to the Mobile Area Black Chamber of Commerce, Mr. King, Ms. Robinson for helping us with this evening. My name is Dr. Nina Ford Johnson. I am the president of the Medical Society of Mobile County, and so glad to be here tonight as we discuss COVID and the vaccine and how we can move this conversation forward. And so I will introduce our panel for tonight and give very brief bios about them. We have Dr. Eichold, who's going to give us opening greetings from the Mobile County Health Department. So glad that he is here. He is the chief, I guess, the CEO or the state health officer, the chief health officer for Mobile County Health Department. And he will be giving us greetings. Then we have Dr. Scott Chambers, who is the guru of vaccines across this country and across this world. But we have been blessed to have him work for the Mobile County Health Department. So he is such a jewel to have here in Mobile. We have Dr. William Poor, who is a pulmonologist, and he has been working tirelessly in our ICUs and in his clinic. And so he will give us a discussion on what he has seen in his office and in the ICU, especially towards African Americans. And then we have, I call her doctor, but Dr. Margaret, and I hope I'm pronouncing her last name right, Osterbine, but she is going to talk about COVID and how it affects the workplace as she deals with OSHA and a bunch of other things to help us understand how COVID has impacted us as business owners. And as a pediatrician, I'm also a business owner as well. And so it has definitely affected my bottom line. So I can't wait to hear what she's going to say about that. And then the last perspective we'll hear from is Andre Reynolds. He is going to give his testimonial about how COVID has affected him and his family in the past year. So if you were to have any questions or concerns, the moderator will show us how that should go forth. But as a physician, we all love questions. So hopefully we'll be able to have a great discussion tonight. Thank you.
Thank you, Dr. Johnson. And as she said, if you should have any questions at all during the presentations from our various panelists, if you would simply put your questions in the chat box, one of our board members, Sharia Mitchell, is going to be monitoring the chat box. And after each presentation, we will entertain questions at that time. And the panelist who speaks on the topic can go first to answer. With any of our panelists who would have any information to share, please feel free to join in. Dr. Johnson, I'll turn it back over to you.
Excellent. So we'll first start off with Dr. Eichold to give us greetings tonight from the Health Department.
You need to unmute.
How about now?
Okay.
All right. Thank you very much for setting this meeting up. It's an honor and pleasure to be with you tonight. Good information is the most important thing we can provide in control of COVID-19. we're finally letting science dictate what we're doing in our community, and not just necessarily politics, but it's a combination of the two that are the challenges that we have in containing and controlling COVID-19. Scott Shavers actually was a vaccine developer with Johnson & Johnson before coming to the Mobile County Health Department. He has a PhD from the University of Alabama in Birmingham. Has been a great asset to our team, as Dr. Randy Murphy, who is on our team from the CDC as a retired commissioned officer. So at this point in time, COVID-19, we're aggressively vaccinating. People in our community are taking it seriously. Masking is working. And I really want to thank everybody on this call for taking this disease very seriously. And the economic impacts are very, very significant. If we did nothing, we'd anticipate 3.5 million Americans dying from COVID-19. That would be a 1% mortality rate. Right now, we're at 500,000, which is a terrible loss. One of my friends, age 58, his daughter's a senior in high school this year, has died from COVID-19. So it's very real disease. And thank you very much for letting us get information out to the community. And if you have not been vaccinated, please do so. It's the most important thing you can do to protect yourself and your family.
Outstanding. Thank you, Dr. Eichold. I really appreciate you coming on and giving your greetings and letting everyone know how serious this is and how it affects any and everyone. We will now start with Dr. Shavers, if he's available and ready.
I am available. I'm still working through some audio issues, so I do apologize, but yeah, I think we'll make this work. So great. So thank y'all for having us. So as I understand it, we would like to talk a little bit about the vaccines that are on the market and maybe answer some questions. Is that correct?
That's right, Dr. Shavers. And if you could also talk about actually what COVID is, if that's okay too. Just kind of like a green, just a little bit of snapshot of what, in layperson terms, what COVID is, and then the vaccines and how they work.
Okay.
You have about 5 to 7 minutes.
Okay. All right. Well, so just quickly about what COVID is. COVID is caused by a family of viruses that are coronaviruses. And most of us growing up, we got common colds, and many of them were coronaviruses. But there are 4 coronaviruses that affect humans and affect us in a way that can lead to some very severe outcomes. So one is SARS, one is MERS. So SARS was the very first one. MERS is the Middle Eastern Respiratory Syndrome. And last year, well, in 2019, we had another virus that was identified that was a coronavirus that as we were looking at the pathology, we saw that it was causing some very serious outcomes. And that's the virus that's called SARS-CoV-2. And there's a long story behind why that's named that. But the SARS-CoV-2 is the virus that causes COVID-19. So CO for corona, Vi for virus, and D for disease. That's where COVID comes from. And 19 is based on the year that it was identified. So one of the biggest misconceptions that I hear around the disease, COVID-19, is that this is a respiratory disease. And it is true in a sense. And in the first part of the disease, you do get you get scarring in the lungs, and that causes an individual to not be able to transfer oxygen from the lungs to the blood. And that can have some very bad outcomes. And that's where you see on the news, particularly early on, people were being put on ventilators and that type of thing. But what most people don't realize is COVID-19 is a disease of the circulatory system. So we see an immune response that kind of goes into overload that affects our heart and our vessels. And it can also affect our brain and how we think. And so I think that's one of the biggest misconceptions I hear, is that this is a pulmonary disease or a lung disease. And it really isn't. And some of the outcomes that we see, particularly in young people, are these cardiovascular events. So where we'll see stroke and we'll see blood clotting and that type of thing. And this is the virus interacting with the immune system that leads to this circulatory damage. So that's the disease. What we do know from an epidemiological point of view, the age group most likely to contract it and spread it are those 25 to 49. We know that those most likely to experience poor outcomes typically are 75 years of age and older, or residents of long-term care facilities. And what we see there is in individuals with these underlying health conditions like diabetes and cardiovascular events. And the virus interacts with these diseases and kind of heightens them, either having an individual with these diseases becoming more likely to be infected, or because their immune systems are not optimal, have these poor outcomes. So that's kind of the epi behind it. So now let's talk about the vaccines. So when SARS-CoV-2 was first identified, part of just where we are in modern science, the genetic information of the virus was decoded in a matter of weeks, which is incredible, and 20 years ago could not have been done. It just so happened that there was a relatively new vaccine technology called messenger RNA delivery. And people think, well, these vaccines have been around since like March of 2020. That's actually not true. The technology has been around since the 1990s. And when I was with Johnson & Johnson, we were trying to use it for oncology and Alzheimer's, and we just couldn't get it to work. But it's a great way of delivering a little bit of messenger RNA into the immune system. So this is what happens when both the Pfizer vaccine and the Moderna vaccine are basically take a little bit of messenger RNA and they take it to your cells. And your cells takes that little bit of genetic information and it produces a protein that looks like the spike protein, or part of that's the spike protein on the real virus. It then presents that protein to your immune system, and your immune system thinks it's being attacked by the real virus. And so your immune system starts to ramp up, and over about a 20-day period, you get a pretty good prime dose with that. After your first vaccine, you are about 50% covered. And what that means in layman's terms is if you meet someone that's infected with SARS-CoV-2 and you encounter them, your likelihood of being infected is about 50-50. It's like flipping a coin, which for epidemiologists, we do not like. That's not where we want y'all to be. But after your second dose, which is 21 days for Pfizer, 28 days for Moderna, then your immune system ramps up. In about 14 days after that second dose, you're over 90% covered. So these two vaccines are one of the highest in terms of able to work, what we call efficacy. They are outstanding. They're also two of the cleanest vaccines we've ever seen in terms of their safety profiles. They literally are sugar, salt, fat, and this little bit of genetic information that your body uses to develop the immune response. Unfortunately, though, because they are so clean, we have to keep them cold, colder than most vaccines. So a lot of the early rollout of these vaccines were hampered because it was just difficult for us to handle. I'll sum up with this. I get a lot of questions about, well, how long is this immunity going to last? And the answer to that is we don't know yet. We only have data that started back when the clinical trials started. And some of the longest data are coming out of Israel, and it's still showing some very, very good sustainable immunity. The biology behind messenger RNA vaccines is it does stimulate your long-acting immune system. So it very well may be that once you complete a series, you may not have to have another dose for 10 years or even longer. The other neat little thing about the way these vaccines are done is if we do have a big mutation, then they're relatively easy to reconfigure to give you a booster to cover mutation. So let me stop there because I can go on and turn it back over to you and see if you have any questions.
Hi, good afternoon. This is Sharia Mitchell, one of the board members from the Mobile Area Black Chamber of Commerce. And there are a couple of questions that we have in the chat box. The first question is, between the 2 doses, should we do anything specifically to increase our immune system?
No, ma'am, you really don't have to. Most people's immune system they're in fairly good shape. You know, you want to be as healthy as possible, just underlying immune response anyway. So that's eating correctly, exercising, keeping your weight down. All these things are very important. Some people do have some deficiencies in vitamins, and that can play a part. But for most people, and when I say most, I mean the vast majority of people, your immune system's ready to go, and it's going to do what it needs to. And the way you know that it's doing what it needs to is your arm's going to hurt a little bit. You're going to feel a little weak the next day. And after your second dose, a lot of people have to go home and lay down, to be honest with you. But that's good. That's called reactogenicity, and that's how we know the immune system's working.
Okay, I'm going to trust you on that one. I finally took my first shot last week, and the doctor that was there supervising came over there and hold my hand. I'm like, are you sure this is going to be okay? Because I was a little nervous about it, but I did it. I'm proud. I did it.
That's good.
Yeah, I was. Wait till the second dose. We'll see what happens, though. So the next question for you, doctor, is why is there a difference between the time to get the second dose and between the different dose vaccines? Why is there a difference?
Why is there 21 days, 28 days?
Correct.
All right. I'm going to tell you guys about how deep science works in the pharma companies. So in one company, they were sitting around the boardroom and somebody goes, well, why don't we do 21 days? And everybody raised their hand and said, okay, let's do 21 days. And then at Moderna, they were sitting around their board table and somebody said, well, let's do it at 4 weeks. And everybody agreed and they did it at 4 weeks. But honestly, I'm being a little flippant, but really it's just how the trials were designed. If you look at how the immune system works over 21 days or 28 days, you could almost lay the curves over each other and they would be fine. I also have to remind everybody in clinical trials, not everybody shows up at the 21st day to get their vaccines or 28 days. It's kind of this curve. So good question. Short answer is it's just the way that they were studied.
Okay, thank you. That's all we have in the chat right now, but we're going to have some more, I'm sure, later. Thank you.
Great.
Dr. Johnson, we can go to the next part of it.
Yes, thank you, Dr. Chavers. And I think that's so important how you mentioned about the circulatory part of the COVID disease, because I lost a friend in her early 40s due to a pulmonary embolism that caused her to have by COVID. And now she leaves a 13-year-old without, a mother. And so this is very serious. But we like to thank you so much for giving us that great information. And now we'll have Dr. William Poor. He received his medical doctorate from the University of South Alabama and did his internship and residency at Fort Gordon, Georgia, and did his pulmonary disease and critical care medicine fellowship at the Brooke Army Medical Center in Fort Sam Houston, Texas. So we thank Dr. Poor for being here this evening, and we turn it over to you, sir, so you could discuss what you see in your ICUs and in your clinics.
Thank you, Dr. Johnson. Appreciate it. Can y'all hear me okay? Yeah,
Yes.
good. Sorry, I'm in my car. When you have 7 kids, this is about the only privacy you get. You know, it has been a very interesting year. We started out, you know, virtually a year ago, not really knowing how this would go. And of course, I think we all have some type of idea of just how bad it is, how bad it was. And fortunately, we're seeing, at least for now, a downward trend in our hospitalizations. You know, this started out, we didn't really know much about it. We kind of knew about, you know, MERS and SARS from the past, but really had never seen it, a coronavirus or really any virus do this, maybe some H1N1 flu, but this was definitely a different beast, as influenza primarily attacks the respiratory tract. But as it was alluded to, this virus, while it does affect the lungs and the respiratory tract, it can affect almost every system in the body. And we didn't really know that when it started. We I think, kind of primarily focused on the ventilator issue, which I think got a lot of publicity throughout the you know, national, local, and worldwide media. But then we quickly learned it was much more than that. We saw blood clots like we had never, ever anticipated. People dying immediately in the ICUs in monitored conditions because of these massive blood clots. And we had no idea you know, what was happening or how to manage it initially. And we quickly learned to adapt and learned about these blood clots. But unfortunately, we did lose many people prior to being aware of that. We've seen medicine change immensely from what we used to know with regards to severe pneumonia and how we would manage that in the ICU. And just in general, how our staff throughout the hospitals have adapted to this. You know, we are one element of our medical care community. We take care of the sickest of the sick, but we have our primary care doctors out there. They're trying to, you know, tell our patients what to do, how to protect themselves. Our frontline ER workers and urgent cares that are trying to help reassure patients that they don't have COVID and manage, you know, the traditional cough and colds that we all get and we all still get, even though this thing exists. And then, of course, then we come into the hospital and we see everything that happens there. I can't stress to everybody on this panel and in the community, you know, there's been lots of pain and suffering and fear in families and patients, but our nursing staff, our respiratory staff, I've seen them, you know, crying and having incredible difficulty. And being in the military, it took years and years for PTSD to be appreciated in our military population, and I can see the same type of tendencies in some of our staff in the hospital. And I think going forward, we're going to have to not only address the fear of opening back our communities up and getting to learn to socialize with one another again, but also appreciate the fact that many of our healthcare workers and our nursing staff are going to suffer from PTSD from what they've gone through over the past year. The infirmary, which is where I primarily work, we finally have opened up our COVID ICU. It's been almost a year since we closed it to COVID only, and our nursing staff became very familiar with that, but we're now starting to take care of the proverbial regular coughs and colds that people would normally come in with. We're still very aware of this entity existing and how to manage it. We've become much better at managing it, not only in the inpatient setting, but the outpatient setting. And I'm seeing patients in my clinic more and more often now that are coming in who have recovered. I had a lady in my clinic who I would have told you last June 7th would not have survived this. And she definitely had all the setups for not surviving it. And she did. She had a windpipe tube in her neck. We call that a tracheostomy. And I took that out back in the fall. And she came to my clinic yesterday, breathing the same air I am. She's still in a wheelchair. but she's talking, she's interactive, she's got her sense of humor back. So people are surviving this, and they're going to survive, and we're going to survive this as a society and a community. And we've learned a lot, we've suffered a lot, but hopefully going forward, it'll make us not only a better healthcare community, but hopefully a better community in general. If anybody has any specific questions, I'll be more than happy to answer them. It's again, I've had a very busy year. It's been, I had no shortage of work, unfortunately. But I'm glad I had the opportunity to do it. And I look forward to continuing to care for this community moving forward.
Okay, Doctor, thank you for that. There are a couple of questions that we want to ask you. One question is there a relationship between blood thinners and the vaccines that the community needs to be aware of?
Not that I'm aware of. Of course, there's a variety of blood thinners that are out there. The most common that I think that you would find in the community are the antiplatelet agents like aspirin and Plavix. Those are commonly used in folks who have vascular disease, whether they've had a heart attack or they have some type of other vascular stent, or just somebody who's on a baby aspirin because they're of the right age, or they have the right medical comorbidities such as diabetes or hypertension. And then you have blood thinners that are more specifically geared towards people who have certain conditions like atrial fibrillation, which can cause blood clots to form, or people who've had a prior blood clot like what we call DVTs or deep venous thromboses, or pulmonary embolisms, which I know was mentioned earlier in the talk. And those are other types of blood thinners that block different pathways for as an anticoagulant. And I don't know of any specific concern regarding the vaccines and anticoagulants.
Okay, then I know you mentioned earlier about the clogging that you saw from patients that were there. So, there are a lot of people who believe in taking an aspirin a day that's going to, help them with heart attacks and all of that. Have we seen that has an effect at all on the response to people's illnesses while they're experiencing COVID symptoms?
So there are a lot of people that are using aspirin as for a outpatient treatment for people who are positive for COVID. I don't know that there's any good data, and there may be that I'm unaware of, that supports its use as having, an outcomes benefit with regards to preventing blood clots. In the inpatient setting, we monitor for blood clots by a couple different tests, one lab, one ultrasound. Those are primarily two ways that we have been monitoring for them. And for anybody who has really high markers of this blood test, many of us are using anticoagulation in a more aggressive modality than we really previously would have, just because we're so, if you want to call it, scared or worried of blood clots because of how quickly we have seen people go from doing okay in the hospital to basically dying and having to get CPR and all these life-saving endeavors that we pursue, and frequently to no avail because these blood clots are very large. And by the time it happens, there's very little we can do. And also what I'd make the community aware of, and I'm not saying this to create fear, but there are blood clots that occur in people who never really have significant symptoms, and so these are a lot of community dwellers who, I'll say a lot of your young females who might also have a risk factor of being on a hormonal or contraceptive. And so you take that individual who may have minimal symptoms as an outpatient, but yet they're positive for COVID. And I'm sure there's probably some developing data out there, again, probably by people a lot smarter than me, who have looked at that population of individuals who've had relatively asymptomatic COVID and the risk for blood clots forming in those individuals. And that is something that I think that we have to be aware of as a medical community, because I know that I have seen people myself who are my outpatients who had baseline pulmonary disease, who we tested, who were positive. We set for monoclonal antibody therapies, but were relatively asymptomatic. And then they come back and they have either swelling in a leg, or they end up coming in with symptoms concerning for a blood clot to the lungs. And lo and behold, they have one of these two or both of these diagnoses, and we end up putting them on an anticoagulant for their prescribed amount of time.
Okay, there's two more questions before we move on, Dr. Johnson. One question is, we've been hearing in the news that there's a new strain of the virus. How can we, as citizens here, how can we as individuals protect ourselves from that? Or how serious should we take that information that's kind of twinkling down through the news pipes?
I think that as far as the vaccines go, I think the vaccine should provide protection. Again, definitely not my area of expertise, but I think the vaccine should provide some protection even against whatever new strains that are out there. What I'll say as far as protecting ourselves, I think continuing to proceed with vaccinating the community, particularly your older and at-risk population, is an absolute paramount importance. And then I still think that there is benefit to masking and social distancing within reason. I tell all of my patients that if you go into an area where people aren't wearing masks, just turn around and walk the other way. For whatever reason, people choose not to wear a mask, and I don't like getting to that topic because I think it opens up a can of worms. I'd prefer not open up, but I think that just being mindful of yourself and putting yourself in not putting yourself in bad situations. I don't want to be fear mongering either. I think that there's so much that can be said for interpersonal connections and building relationships with people, something that I think we've unfortunately have suffered from over the past calendar year as we have distanced from one another. But I think we have to be mindful that this disease is out there. It's still evolving. We don't have enough people out there that are vaccinated to provide so-called herd immunity. So, really we still have to be very vigilant about our exposures and our and how we go about carrying ourselves in the community. But I think vaccinating is something we have to pursue. Vaccinations have worked for viruses over the past decades. Look at the diseases we've practically eliminated from the globe just by vaccinations. I pray this is one of those diseases that we can do. Lord knows we don't need this suffering to continue. So hopefully people will take that to heart and ask the right questions. And hopefully we can give them good educated answers so we can alleviate their concerns regarding some of these vaccines.
Thank you so much. Appreciate that. And what your response actually leads us to one of our next questions. And Dr. Eichold, you may want to be a part of that conversation. In your opinion, is it safe for the city to open up for full business?
I mean, I don't know what Dr. Eichold is going to say. I would say that I'd say you have to urge caution. I just don't think there's enough. And I don't know what the percentage of people vaccinated in Mobile County is, but I'm sure Dr. Eichold probably has that information. But I personally would say I want businesses to open, but I don't necessarily want my bad overweight COPD patient out there, socializing in a restaurant with a bunch of people who are, sitting down eating, carrying on conversations, not wearing masks, drinking glasses of wine and things like that. I mean, I just would worry about their exposure. I definitely am glad I don't have to make those types of decisions. You can just take care of them when they get sick. But Dr. Eichold may be able to chime in there.
Yeah, thank you very much. It's a very good question. And I will tell you, at this point in time, we have about 25 to 30% of the population vaccinated or have some kind of exposure immunity. So 70 to 80% is the goal to have herd immunity. So if we look at the data and understand the science, the answer to the question is it's a little early, but we have lots of vaccine available. We need to vaccinate people. People still need to use caution as we go forward, protect themselves and protect their families. It's not time to go back to business as usual. Right now, we have decreased community transmission of COVID, which is really, really good. We're excited. But if we look at what's happening down in Miami right now, I think the data is going to negatively impact health and increase community transmission rates by what's going on in states that have gone back to just business as usual. So caution at this point in time. Get vaccinated. Let's support the local economy, but do it very cautiously for the next 6 to 8 weeks as we get more people immunized.
Thank you. Dr. Johnson, there's not any more questions in the chat right now. You want to go to your next segment?
Yes, and I want to definitely thank Dr. Poor, and he is very, very busy, several meetings. He had a long clinic day, and he's got a beautiful family of 7 awesome kids. So he's in his car trying to get some privacy from them. So we definitely want to thank him for joining us this evening. And thank you, Dr. Poor, for your optimism and all the hard work of you and your staff. We are praying for you and the rest of the nurses and the doctors and respiratory therapists, even the custodians and everybody who's playing a part in taking care of the sick of the sick. So we thank you tremendously. We also want to say how important it is it was mentioned that, people with underlying health conditions like hypertension and diabetes are at higher risk of dying from COVID, right? So we definitely want to make sure that we do not neglect our well checks, our annual exams that still need to happen. So we need to make our visit to see our primary care doctor every year and make sure that we follow up and do those things that we're supposed to, like getting a colonoscopy and getting the prostate check and getting, the mammograms, because people are still dying from other things other than COVID too. So we cannot neglect our health, not just our physical health, but also our mental health, like Dr. Poor suggested, for all of us. So thank you. So we want to move on to Margaret Osterbein. And Margaret, I hope I'm saying that right, but she is a physician's assistant who works as an industrial hygienist and is actually a PhD candidate at UAB. So we want to thank her to give us some information on COVID and how has it affected us in the workplace. Thank you so much, Margaret, for joining us this evening.
Thank you for having me. So I guess to sort of give everybody just a very brief overview of what I do as an industrial hygienist. For those of you who are not familiar with the profession, we fall under the umbrella of occupational safety and health. And the technical definition of what we do is the recognition, anticipation, and control of workplace hazards. So we're sort of the people that would come to your workplace and take air samples, measure air quality. We work in a lot of industrial settings. I was out taking hexavalent chromium samples last week. So that's kind of the world that I come from currently. Now, how does that apply to coronavirus? I will tell you from an industrial hygienist point of view and from the point of view of safety management in general, the control of COVID-19 in the workplace has been, I would say, difficult and frustrating for a couple of reasons. Number one, we're used to a very systematic way of controlling workplace hazards. And now we have an agent in the workplace where we have no known infectious dose. We have no known exposure limits to which we can compare and say, okay, this level is safe, this level is not. So pathogen exposures don't have those exposure limits. They're not easily or routinely measured in the air. So again, controlling COVID-19 in the workplace from a systematic perspective has been somewhat difficult. Nevertheless, there are some basic control measures that we've been trying to help businesses implement. And we do that through a hierarchy of control measures. If you guys are familiar with the hierarchy of hazard controls, the first thing we like to do, obviously, is eliminate the hazard altogether. So in this particular scenario, that would manifest as working from home when possible. And in so many professions, it's simply not possible. So working from home eliminates the hazard in some cases. Engineering controls is a big thing we've been working on as well. And when I talk about engineering controls, what I'm usually referring to is actions to optimize the HVAC system in your workplace. To the greatest extent possible, introducing fresh air ventilation into your workplace, making upgrades to the filters if you recirculate air in your building. I know OSHA has put forward some general guidance. It's optional, not mandatory, regarding the grade of filter that you use to recirculate your air. Increasing the number of fresh air exchanges. That's something that if, for example, you work with your HVAC preventative maintenance contractor, you can have them maybe adjust the dampers in your HVAC system to optimize that fresh air ventilation. The thing about the HVAC systems in so many office buildings and also a lot of residential buildings is that they're designed for a particular purpose, and that purpose is to deliver air within a specified range of temperature, relative humidity, and based on the occupant density. Unfortunately, a lot of our HVAC systems are not designed for contaminant removal. And that's one of the biggest challenges we've seen. So really, if you're able to make upgrades to your filter system, in your HVAC, that's a big thing that's actually been recommended by OSHA, although it's not mandatory, of course, at this point. Engineering controls, again, I sort of touched on the HVAC aspect of that. Also, what we call administrative controls or work practice controls. And these are the controls that I think a lot of people are more familiar with. Physical distancing in the workplace, staggered shifts, so that, if you're not able to physically distance, at least you can sort of, avoid close physical contact between your workers. And then, of course, what we consider the last line of defense is personal protective equipment. So what I've been doing, again, we've been dealing with this, I can't believe it, but for over a year now, is helping businesses implement some of these controls, safe work practice controls, engineering controls, developing policies, basically infection control policies for workplaces. A couple things I guess wanted to mention, sort of the interface with OSHA. If you're not aware of this, this is interesting. OSHA actually just recently, in the past couple of weeks, issued what's called a national emphasis program. A national emphasis program is where OSHA decides to start directing its resources and its enforcement actions in particular segments of industry. And they actually have recognized the healthcare sector as one of the sectors where COVID-19 transmission is likely. So again, just to sort of put this on people's horizons, OSHA has recognized healthcare in its national emphasis program, and we are likely to see a little bit more enforcement action and inspection in the healthcare setting going forward. The other thing that I think might not be on everyone's horizon is that COVID-19 is an OSHA recordable illness. So if your business is required to fill out those OSHA 300 forms every year, where you present to OSHA, your reportable incidents and illnesses. Again, just remember that OSHA recognizes COVID-19 as recordable, and it has some guidance for how you make a workplace determination. It's extremely difficult with the levels of transmission that we see in the community to determine whether or not a case was work-related or if it was acquired in the community. So that's another thing that I think some businesses have struggled with over the past year. I would be happy to take any specific questions regarding occupational safety and health and how that relates to coronavirus. And again, thank you so much for having me on.
Hi, yes, we do have a couple of questions for you. One question is, can an employee and or employer request that their workplace be tested if they're concerned with sanitary measures? And if so, will someone from your office come in and teach them about better safety measures once that's been reported?
So in terms of testing, this is something that I don't personally endorse. There's a surface test called an ATP test that I think some companies have used as a proxy measure for the effectiveness of disinfection. Again, that's something that I don't perform, but it's one of those things that I believe money and resources could be better spent elsewhere. The surface testing measures, again, are, I guess it's difficult to correlate the results of an ATP test with viral load for COVID-19. So again, it's something that I don't personally endorse at this time.
Okay, thank you. There's another question here. I'm not quite sure if I fully understand it. There are many companies claiming to provide sanitizing and cleansing of the air via HVAC systems using UV and certain filters. Can you comment on that?
I sure can. UV disinfection, this is like an adjunct method of cleaning the air. It sits inside the ductwork, away from people, so there's no UV exposure to the person. What I tell people about UV systems is that it's not a complete control method. It's an adjunct. It's not a total solution. There's no replacement for the provision of fresh, clean air in terms of outdoor air. There's nothing that you can really replace social distancing with. I mean, it's an adjunct. It's not a total solution. The only thing I would say about UV as well is just to caution people. You know, the UV can only really disinfect if it can reach the virus. So if you have like you know, dust buildup or dirty ductwork, you know, you're going to have your ducts clean as well for this to be really effective.
Thank you, Dr. Johnson. There are not any other questions about this topic right now.
Excellent. Margaret, thank you so much. You're so very informative for giving us the business perspective of COVID and how we can better handle our business in this day and time. So thank you so much. And our last presenter tonight will be Andre Reynolds. He is a realtor extraordinaire here in Mobile, and he will talk to us about how COVID has affected him and his family as a personal testimony. So I want to thank you for joining us this evening, Andre.
Thank you, Dr. Ford, for having me. So back in November, my family got hit really hard with coronavirus. And what happened was my wife had gone to dinner with a couple of friends, and the friend called her and said, hey, I just tested positive. You may want to go get checked. And so, so my wife, she went and got checked. And so everybody in the house, all of us, we went. My test came back negative. And so what I did was I isolated myself. Well, she isolated herself in the bedroom, and I have 3 daughters, and my mother-in-law, she's building a house, so she has been staying with us. She's 72, and so she, so my wife just kind of stayed in the bedroom. We, you know, passed her meals and everything like that. And so when we went to urgent care, we got tested. And the doctor said basically, if one person has it, then you could pretty much guarantee that everybody in the house is going to catch it eventually. And so I was fine. And then all of a sudden I started feeling the symptoms, coughing, and started getting a fever. And so my wife started to kind of get a little bit better. And so I went back, I tested negative 3 times, and then I started feeling really bad. So one day I was getting out of the shower. It was so hard to take a shower. And so I laid across the bed, and my wife was like, I need to take your temperature. And so my temperature was, at that point, it was 104. And she just said, no, you're going to the hospital. I'm calling the ambulance now. So when she called the ambulance, as soon as the guy came in the house, he just said basically, oh, he has COVID for sure. He just by looking at me, I was so weak. I was so drained. I couldn't do anything for myself. I couldn't even tie my shoes. Couldn't walk 5 steps without getting winded. And so once I got to the hospital, the doctor, he really wanted to release me. And I just said, please don't, because I couldn't breathe. And I was so weak. I never experienced anything like this in my life. And my head was hurting, and my wind, I mean, I just couldn't catch my breath. I just couldn't catch it. And so in the meantime, my family, my kids, I have a 5-year-old, a 10-year-old, and an 18-year-old. For them, it was just like a little cold. I mean, they bounced back immediately. But my mother-in-law called it, and she, like I said, she's 72. She has diabetes and high blood pressure, and that was back in November. She just got off oxygen last week. The doctor took her off the oxygen, and she's still, I mean, she's still struggling with her health. Basically, they didn't want to say, that she wasn't going to get better, but it's almost like this is day to day. We're still running tests. We're still trying to figure this thing out. And so they just weren't certain. But back to my story. So I got to the hospital and the doctor said, well, yeah, we're just going to keep you. And I'm so grateful that he did, that he decided to keep me. So once I got in, they put me on a medicine called, I think it's remdesivir, something like that. And by the third day, I started to feel a difference. Because I know the first day I got there, I couldn't, how small those hospital rooms are. I couldn't walk from the bed to the bathroom. I needed assistance, and I'm 37 years old. I mean, good physical health, never been sick like this. And so that was the first time I've ever experienced an illness like this. And so finally the doctor came in and said, man, you're gonna make it. But what kind of scared me was one of the nurses came in about 4 o'clock in the morning. She said, we just had 28-year-old patients to come in, and we lost them last week. She said, just be thankful that, you got here in time, because you're going to make it. And I think that was like the second day that I was there. I couldn't see or couldn't tell where I was, if I was going to make it, but she had hope, and that helped me, because, you don't have family can't come see you. And that helps when you have nurses and doctors that really care and put forth an effort to see you get healthy and get on with your life, basically. And so, from that day 3, it was a 5-day, I had to be on that medicine for 5 days. I was in a hospital a total of 6 days. So they wanted to watch me and make sure. So I got better. I got out of the hospital on that 6th day, but just going back for my checkup, the doctor was like, no, don't go back immediately to your daily routine. Take time, build your strength back up. And by me being a realtor, what I did was, I was like, well, okay, I'm fine. I'm able to go back out. So I put my mask on, and that following week, I went out and started showing houses. And I said, I had to sit down at the visit, and I couldn't catch my breath. And I was just stunned. And so I called the doctor and I said, man, this isn't getting better. He said, no, you have to take your time. And so now this is March. So all of January and all of February, I was still struggling to get back to myself, just trying to be normal again. And so even now, I still have gaps in my speech. I have to take my time building back up, exercising and stuff like that. So I can see major improvement, but it's very, very serious. And I don't think that it's time to take the mask off. I'm not a doctor by far, like any of these professionals, but just the experience that I had, I don't want anyone to have to deal with that, especially, people of age, because you're fighting for your life, and you just want to get healthy and get back to normal. So you have to do what it takes to get to that point. And so, finally, I'm able to kind of get back to normal and do my normal routine. But it took some work to get there.
Yeah, Dr. Johnson, we did have a couple of questions to ask. First of all, we're so happy that you're back. Andre and I actually used to work together some years back. So it's great to see him again, all smiley and happy. That's the Andre that we know, the happy, smiley Andre. So we're indeed blessed to have you back with us. So a couple of questions also to the doctors here are, how do we look at the part with people who are testing negative 2 or 3 times, but still end up having COVID? How does a family member or person know, well, you keep telling me I'm negative, but I'm not feeling better, and then they send me back home. So what is one to do?
Yeah, that's a challenge. Make sure, yes. So that's a challenge. And the main thing is to continue to go back to your doctor to have that conversation. There are antibody studies, so we can draw blood to make sure that what the test shows. Now, usually if a test is negative, well, if a test is positive, I'll say this, you're more than likely positive, right? There's hardly ever false positives with COVID. There are false negatives. There's more. And so and there's so many different tests by so many different manufacturers out there. Sometimes it's difficult to know which one is the right one. But usually if you have a positive test, it's usually all the time positive for COVID. Negative can be iffy. But especially if it walks like a duck and quacks like a duck, then it's a duck. And so that's kind of what we have to go by, especially if there's a strong history that states that you are. I hope that helps.
Okay.
I can quickly give you just a couple of numbers depending on.
Oh, good, Dr. Chavers. Oh, good. I'm glad you're still here.
Sorry. So these are the rapid tests, the ones that you can kind of go into in urgent care and they come back in about 15 minutes. Those are antigen tests. And as was said, they're highly sensitive. So if they come back positive, there's about a 2 to 4% chance that that's wrong. So usually they get that one right. But if it comes back negative, and as was stated, if it's walking like a duck and talking like a duck, that's where we get nervous because they can be incorrect or basically giving you a false negative up to 20% of the time. So that's a high level. So those are the antigen tests. The better tests are done by what we call PCR, and that takes longer to do. Sometimes it'll take a day, sometimes it can take up to 3 or 4 days. And those are very, very sensitive and very, very specific, meaning if they tell you you're negative, you're typically negative with those. So the algorithm is if it's walking like a duck and talking like a duck, but your test is saying no, it's not a duck, then you go to PCR for a better read on what the true status is.
Okay, thank you, doctor. Appreciate that. Another question is, of those who have recovered from the virus, a top priority to get the vaccine, even if they're of a younger age, not in the group that we think should get priority vaccinations?
Yeah.
Dr. Chambers, do you want that or I can take it?
I can do that one. So when you're infected with the virus that causes COVID-19, you have a natural immunity that builds up. Now, that natural immunity is not as strong as what you will get when you finish the vaccine series. But what you will hear is, please wait 90 days before you're vaccinated if you're if you're isolating. So there's some science behind that, but there's also some practical things behind that. And the real thing that's driving that is we still are, although our vaccine supplies are doing incredibly well compared to where we are a few weeks ago, if you're positive, if you've been infected, if you can wait and let us vaccinate those that we really need to vaccinate at high risk of infection or poor outcomes, you're saving the vaccine supply. And then hopefully by the time we get into 3 months or later, we'll have more vaccine. That being said, if you came in and you finished your isolation, I'm going to stick you because I'm going to vaccinate every single person that's standing in front of me that's eligible.
I think Andre wanted to share an additional piece with us.
Okay, so I did get vaccinated about 2 weeks ago, and I've had my second dose as well. And so on the first one that I took, I told my wife, I said, this isn't right. I said, I don't feel good. I said, it feels like I got COVID all over again. And so I started to feel weak and I was starting to get scared. And so my arm was aching tremendously. And so she was like, well, no, let's see, let's just rest and relax, and let's just go through the night. And so that next day I was still kind of feeling down or whatever, but then it just went away. And on my second dose, I didn't feel anything. I felt fine. Not my arm didn't even ache. So prayerfully, the vaccine is working.
Yeah, and actually that's a great story because you were infected, or you're going to have some of the best immunity of all of us because you've got wild type protection, and then you've got protection from the vaccine. So what actually happened is your original infection, what we call wild type infection, you can think of as your first dose. And then when you got stuck with your first dose of the vaccine, it's like your second dose. Mm-hmm. So that's why, in my theory, you had such a reaction. Is you were seeing that. I'm so glad that you didn't have some people on their second dose that have been infected earlier, and they really do have to go home. But yeah, you're going to come out. You're going to have a great immune profile after this.
Okay, Dr. Johnson, here's another question. If a person test comes back undetermined, what happens to cause that kind of result?
Dr. Chambers, you want that one too?
I'm happy to do that. I love talking about this stuff. So I'll talk until you tell me to shut up. Yeah. So when a test comes back undetermined, it basically means that something in the system just didn't quite work out the way it was supposed to. Meaning that when the sample was run, it didn't, either the control didn't run right. So the checks and balances just didn't line up. And that can be anything from you ended up with a bad test, or the person that was handling the test did something wrong. So this is kind of public health in the real world where not everybody's perfect. And so that's why sometimes they come back undetermined. And that's where we do suggest getting tested again. So there's something that broke down in the mechanics of everything.
One last question. And if a person is around someone who's tested positive and then they are sent to quarantine, what things should they be concerned about themselves? So if you're sent to be quarantined, does that mean away from your family members at home as well? So what is that quarantine? What should it look like for a person who's been around someone who actually tested positive?
Right. Well, so first, absolutely watch your symptoms. I would say consult your healthcare provider, because the best way to determine this is to be tested. So initially we would say, go home for 10 days. You do want to quarantine. So go see your healthcare provider, watch your symptoms, get tested. And until that test comes back, you need to stay away from everyone to the best you can. Because if you are potentially infected, and I'll just, not to be the harbor of doom, the base UK variant that we had here a year ago is it's an infectious disease. It's one person on average can infect 3 to 4 people under normal conditions. With the new variants that are out here now, that number has increased. And so being very, very cognizant about breaking these infectious networks, please keep that in mind. So it's keeping not only yourself safe, but everybody around you. And in particular, if you've got individuals at high risk, like grandma and grandpa, or somebody that's diabetic, obese, that type of thing, you got to stay away from them until we know what the situation is. And your healthcare provider is the best way to handle and manage that.
Well, there were some companies who were using a guideline that said you must have been around that person for at least 15 minutes and at jobs. And so if you were saying I was not with them but for 7 minutes, then they said, okay, then you have not been exposed, so you need to come to work.
Yeah.
What's the thought on that?
Yeah. Well, so what that definition actually comes from is it was being within 6 feet of someone for 15 minutes cumulative over 24 hours.
Okay.
That's actually a contact tracing definition. That's something we use in doing epi investigations that would designate somebody potentially exposed. What a lot of people forgot about it was that cumulative part. So they would say, hey, I was with this person for 5 minutes, we went away, we came back, hey, it was another 4 minutes. But at the end of the day, they were with that person over an hour or so. But infectious diseases is time and space. That's how infectious diseases move. Is given enough time and given a narrow amount of space, that virus can figure out a way to get from me to you. And so that's just an example of time and space. And it was a definition. Unfortunately, a lot of people didn't understand that, and businesses wanted people back in, et cetera, et cetera. And to be very transparent, it was not the best use of that.
Okay, and there's one last question here. It says, what is this new gold IVPB that's used to treat?
And I think they made the monoclonal antibody.
That's
Go ahead, Dr. Chambers.
No, ma'am, you go. It's your turn.
She knew right away what that was. Yes.
And so that's actually sort of kind of like an immune therapy, that's used to treat a COVID infection. 2 hospitals, I know Providence and Mobile Infirmary do it, and maybe South as well, not Spring Hill, but it's used to treat people who have COVID and a COVID infection. They can be referred by their primary care doctor, by urgent care, or even a self-referral to those places, and to get the antibody, which actually helps treat COVID and helps fight it. So it's not an antiviral or anything, sort of like a kind of interesting immune therapy to use to fight, and helps boost your immune system. I hope I'm saying it kind of like the correct way, to fight COVID. It has shown great success of keeping people out of the hospitals, actually, and out of the ICUs. So maybe out of hundreds of tests that are 100 of antibodies that have been given to patients, maybe 1 or 2 out of like 700 at Mobile Infirmary needed to be admitted. So it actually does work, but it's usually for those ones who maybe be at high risk, who have hypertension, diabetes, or really are starting to get kind of sick from it, but not the ones who are about to be admitted or who are on oxygen or something already. They would not qualify for that.
Interesting point, though, on this treatment. This is one of the few things where we will not vaccinate you. So if you've had monoclonal antibody treatment in the last 90 days, we will defer you for vaccine, because these things are so good in how they work. If we put the vaccine in you, the monoclonal antibodies will come through and totally wipe out that vaccine. So it's like we poured it out on the floor. So this and vaccines in the last 14 days are the 2 things that we will say, hey, come back and see us a little later.
Okay, Dr. Johnson, those are all the questions that we have for tonight.
Excellent. Mr. Reynolds, I want to thank you so much for your outstanding testimony. I'll have to say this, that something that I've noticed in my office with several of the kids who I've had taken care of with COVID is the lack of breath sounds that I hear. So these kids, they'll come in looking really sick, like they can't catch their breath. They're coughing, and I listen to their back. And one time I even had to tap my stethoscope to see if it was working, because I couldn't hear anything at all. And I do have several kids who had contracted COVID who are considered my long haulers. So they're still recovering 3 to 4 months later because of COVID infection. So we talk about adults, but we also must remember that children can have serious risk of that too. And the last thing I want to leave us with is this. Black people die 2 to 3 times at a higher rate of COVID when they hit the ICUs than other nationalities, to my understanding. So we have a fear of COVID versus the fear of the vaccine and government. So what are we more afraid of? Okay, so that's why we are doing this tonight, to make sure that we vaccinate. The vaccine is covering these variants that are out there, and these variants are more infectious and possibly more deadly than the standard COVID-19 virus that we're seeing out there before. That was last year. So we definitely want to continue talking about this. We definitely want to continue talking about the importance of getting vaccinated for our community. Okay. And I think that's all. I want to thank Ms. Robinson and Mr. King, Chairman King. I want to thank Dr. Eichold, Dr. Poor, Ms. Margaret, thank you so much. Dr. Shavers for your wealth of knowledge, and Mr. Reynolds for just taking time out of your busy schedule for being here this evening. Have a blessed night and please stay safe. Continue to wear your mask too if you want to be doubly safe. Okay, thank you.
Thank you so much, Dr. Johnson. I certainly appreciate you putting together this panel list of experts. There was a wealth of knowledge shared with each and every one of us tonight. I would also like to acknowledge that Dr. Felicia Wilson is also one of our guests tonight, and I'd love for her just to say hello to us. She chimed in so that she could listen to all of the experts share the wealth of knowledge. And to Andre, he and I have worked together for quite a while, and there is no one who loves to see that big old beautiful smile more than I do. Very excited to hear that he is on the mend. And lastly, I will say that I'm very proud to announce that I got my first shot today at the Sims Pharmacy. Reminded me of being in Mayberry, because when I walked in, everybody knew everybody. The pharmacist was calling everybody by their first name. So it was a good hometown feel. And I had it early this morning and I continue with my day. So I'm praying that there will be no repercussions afterwards. Thank you all so very much again for sharing this wealth of knowledge. I have taken probably 2.5 pages of notes. So I learned a lot. And this is what we have to continue doing, is sharing the word throughout our community, because there is yet so much more for us to learn. And Dr. Shavers and Dr. Eichold, when I see you on TV now, I'm going to tell everybody I was Zooming with them just the other day. So thank y'all so very much for sharing your time and your expertise with us. And at this point now, I will turn it over to our chairman of the Mobile Area Black Chamber of Commerce, Mr. Levy King.
It is my pleasure to mimic all of these wonderful words of accolades and appreciation tonight. This has been extremely empowering, I tell you, and I just want to thank each panelist for their wealth of knowledge and expertise and their stories as well from Mr. Johnson, and thank the board for putting this together tonight. You guys have done a phenomenal job. And for those of us who are not members of the Mobile Area Black Chamber of Commerce, please go to our website. Please visit our website and think about joining us, because we're going to consistently do more of this type of programming that not only educates our members, but it also educates the community as a whole. Dr. Johnson, thank you so much for your willingness from day one with the conversation of doing this. You were yes from the beginning. You were yes tonight, connecting with Ms. Robinson. You were yes with her. So we thank you for pulling all of these experts together. So again, thank you all for a wonderful event. Thank you all for a wonderful night of information empowerment. And you guys have a wonderful, wonderful evening, and get your shots. I'll turn it back over to Ms. Robinson.
Dr. Johnson already gave us a few words, but we would like to, of course, allow Dr. Eichold to share a few final words with us before we close out for the evening.
Well, thank you, everyone. It's great being with everyone. Please be safe. Thank you for all that you're doing in educating the community, your family members, and protecting them. And let's all get vaccinated, and let's make COVID-19 part of our history, not part of our present disease inventory.
Very good. Thank you so much. Well, I am sure that all of us have thoroughly enjoyed tonight and have learned a lot. So thank you, everybody, once again. And at this time, we will say good night to each of you. Be safe, wear your mask, and sometimes wear 2 of them. Thank you so much.